Thanks for joining us for today's briefing. It's been another difficult week in the region during the pandemic. So many people are testing positive. It's having a huge impact on businesses, schools, and particularly on our ability to deliver health care. We have more people in the hospital now than we have at any other point in the pandemic. We'll talk about that a bit more in a few minutes. But something else we're seeing is some signs that the spread of the disease may be slowing down a bit. We still have over 1,400 people in hospital in St. Louis, which is a good deal above where we peaked last year. But it looks like the number of new cases appearing each day is slowing down a bit. It may be leveling off. It's too soon to say that for certain, and we don't want to get ahead of ourselves. And even if it is starting to slow down, remember that there are hundreds of people in the hospital and will be for weeks to come as we get down the backside of this. Many people are asking, when is the peak, as if that's a point at which we can start to relax. But that's really not the case. We have a long way to go before we get back to something that feels more normal and before the health system can fulfill all its responsibilities for taking care of our communities. We're going to talk in a few minutes as Dr. Garza reviews the data. But the reasons for the slowdown are multiple. I mean, first of all, every day people are getting vaccinated and boosted, and that continues to be the best way to avoid hospitalization. So for those of you who have done that, thank you very much. But we also have more accessible testing. Once people are testing positive, they're able to isolate and avoid further spread. So that's been useful. And finally, I think many people are doing what we've asked them to. Employers have been allowing individuals to work from home. And I think others have been taking personal precautions of wearing masks and distancing and staying away from crowds. So all of those things together are helping slow the spread and are allowing us to see the end potentially. But as I said, it's really not time for us to take our foot off the gas. It's still a vulnerable time for our health system and for the people in the region, especially for people who are not vaccinated. And for those among us who, even if they have been vaccinated, have diseases that make them vulnerable to infection. We've got a long way to go. The other thing to remember is while things are looking a bit better, we're still having many deaths in the region. We've had more than 600 people die from COVID just in the last 2 months. And those mortality figures are going to continue to accumulate. There's a perception that this variant of the virus is milder than its preceding variants. And while that may be true on any individual case, it's still at a population level going to wind up with a lot of deaths and a lot of other challenges. The other thing that we've heard a lot about is the idea of herd immunity. And if we just sit back and let the infection run, won't that get us to a point where we're immune to the disease and transmission stops? And while inevitably, if an infection runs unfettered, it does reach a point where so many people have been infected that transmission stops. That really ignores the human cost of not taking action. We have a vaccine. It's highly effective. It's much less troublesome to get a vaccination than to experience a bout of COVID. And that protects those in the population who really don't have the strength of an immune system to ward off the virus, have another confounding disease that makes it harder for them to withstand the virus. And for those among us who appear perfectly healthy, but still suffer grave consequences when they contract COVID. So with those remarks aside, why don't we move on and look at the data. Dr. Garza is going to walk us through the latest information and show us what's actually happening.
Great, thanks, Clay. So let's take a look at the data for today. So we always start off with our slide showing COVID in the United States. And you can see from this map, which we adapt from the New York Times, that the Omicron variant is fairly widespread and pervasive across most of the United States. Now, those darker areas that you see are the ones that have the biggest challenges, and we're among them right now. The map is most likely going to get darker over the next couple of weeks, and that's going to start hitting even harder, more for I think the way that the path that we've been seeing is it's going from the urban centers out. which is going to be particularly challenging for some of our more rural areas as well. Moving on to our next slide. So this is, as we typically show, it's a projection of where we believe our hospitalizations are going. And so this is an updated look. Now, remember, we run these on Thursdays, so they're always a little bit behind, and we're always adding new data as it comes along. But right now, it's tracking fairly well with what the predictive modeling is showing. So we're not going any higher, which is good to see. But we're tracking along that best guess scenario. So as I said, as we collect more data, and as you heard Dr. Dunnigan say, we are noticing a slowing in the number of admissions, which is, I think, it's a positive sign. But we always want to make sure that we have more data before we make any sort of comments about whether we think this is actually a slowing of the pandemic. Now, this next slide shows the EPI curve, and that's for the number of cases. And so I think everybody has seen graphs like this before, showing that dramatic jump in those COVID positive cases. This is a little bit of delayed data. We don't have data incorporated from over the weekend because of the holiday, but nonetheless, it shows that there's still a high amount of people that are testing positive within our communities, and we'll update these slides as more data comes in. Our next slide shows the admissions, and so as we had mentioned before, our most recent admissions data, and this is dated from a day ago because it takes a little time to populate our data for today, but this shows that we have seen a slowing of admissions, and we're hopeful that this then represents that not as many people are getting sick enough to be admitted to the hospital. But don't forget, 145 people being admitted is still a lot of people, and so even though we'll take this over a 200 a day, it's still a lot of people. And then there's a couple of other things that we want to make sure that we're not reading too much into this. Holiday weekend, there was weather, that may have prevented people from coming to the hospital, things like that. And so, again, we're trying to accumulate a little bit more data before we interpret this. Moving on to our next slide, our hospitalizations, again, as Dr. Dunnigan said, over 1,400 people sick enough with COVID that they've needed to be hospitalized. And as you've seen in the headlines, we continue to set those new daily records. But again, the good news is that the percentage increase day over day has slowed down. But nonetheless, this is still a huge number of people that are in our hospitals. Moving on to our next slide, our hospitalizations, ICU, and ventilators. As we had mentioned before, over 1,400 people are in the hospital. We have over 200 people in the ICUs, and about 119 patients are on ventilators. So still a lot of sick people in our hospitals, a lot of them requiring help to breathe by the ventilators. And moving on to our next slide, and unfortunately, as again, Dr. Dunnigan mentioned, deaths from COVID are a lagging indicator, and so they always come as one of those later metrics that we use. And we're still seeing a high amount of people passing away from COVID, and we're probably going to see this in the foreseeable future, as well as many of these people that are in the hospital succumb to the disease. And that's an unfortunate outcome from this pandemic, but it's something that we expect is going to continue. Moving on to our next slide, which is the reproductive factor. And so this is one that we use to emphasize how much of the virus is transmitting out in public. And so as you heard us a week ago, we were at the highest point that we had ever seen in the pandemic. Now, luckily, or it's it's a good sign that it's starting to come down. And so right now it's around 1.37, again, down from that high point, but still incredibly high. And so even though relative to where we were at the peak, it's come down quite a bit. But remember, it's still incredibly high for any time that we've had in the pandemic. And so although we're glad that it's coming down, it's still no time for celebration. And then moving on to our pediatric hospitalization slide, this one really shows the impact for our pediatric patients. So as you can see, 27 patients under the age of 11 and 26 between 12 and 18 in the hospitals. So that number has come down slightly from our peaks as well, but still maintaining a significant level that is having an impact on our children's hospitals. And you couple that with really low uptake of pediatric immunizations, and we'll probably continue to see this number fluctuating around that 50 to 60 mark for the foreseeable future as well. So that wraps up our data slides. I'm going to turn this back over to Clay for some closing remarks.
Thanks, Alex, and thank you for reviewing the data. Besides the impact that COVID itself is having on people, whether it's the mortality rates that Alex has talked about, or long-term consequences, even the short-term consequences, this is not a mild virus. It may be milder than the Delta variant or other preceding variants, but it's still a pretty serious disease. But in addition to that, COVID continues to compromise our ability to deliver care. Many non-urgent procedures have been postponed. We've had to curtail transfers to the region. Some of you may have seen articles over the weekend talking about smaller hospitals who've been unable to get citizens from those regions to higher levels of care, and a lot of other things. Emergency rooms continue to stack up. We have a large number of people who have to stay in an emergency room overnight or even multiple days before they can be transferred to a place where they can get the care they need. When EMS people get sick, our ambulances are constrained, and they may not be able to get to individuals who have time-critical diagnosis as quickly as possible, or to take people where they want to go for their care. We're also having some other challenges. There's a critical blood shortage in the region, and challenges in the supply chain continue to threaten different aspects of care that are important for our citizens. So while we're seeing some positive signs, we've got a long way to go. The pressure on the health system is unprecedented. Our ability to meet those demands is really compromised by the various shortages and staffing challenges we have. And so this is not a time to relax and say we're done with it. At this point, we want to make sure we thank everyone who's taken steps to help curtail the pandemic. Those of you who've been vaccinated, thank you, and boosted, thank you very much. We again see that boosting is very helpful in preventing serious disease, hospitalization, and death. And those of you who are wearing masks and avoiding gatherings, again, thank you for those steps as well, which help us reduce transmission in the region. Once again, thank you for joining us. We'll see you again next week.